20 years ago, no one thought that the life of most human beings could not go on without a small screen in their hands. The cell phone and tablets caught constant attention because of the possibility they offer to be in contact with other people, watch videos, read books or articles, follow the news, the to-do list, play games, among many other activities. But the frequent use of technological tools can generate the called text neck syndrome, a disorder that generates pain in the neck by using the cell phone with an inadequate posture, and that could be increasing with the development of the pandemic as it has led to mobility restrictions. In some cases, there are people who slump on a couch or bed to rest, but pick up the cell phone and tablets from those positions. Others sit or use it while standing, but with their head down. With frequent smartphone use, one can then develop text neck, a repetitive strain injury that is becoming increasingly common. The disorder is characterized by acute muscle pain in the neck and shoulders, and sometimes in the lower back. It is occurring even in adolescents and young children. Normally, the incidence of neck pain increases with age, recounted Dr. Robert Bolash, a pain management specialist at the renowned Cleveland Clinic in the United States. But today we are seeing and treating more younger patients who have never reported neck pain before. How does using a cell phone or other mobile device cause the damage? It all depends on how you look down at the device when using it. Looking down and dropping your head forward changes the natural curvature of the neck, Dr. Bolash explained. Over time, that misalignment can strain the muscles and cause wear and tear on the neck structures. That's because when the head is dropped, three things happen: the neck shifts forward, the shoulders round forward or lift toward the ears, and the muscles of the neck and shoulders contract. The neck muscles, in their correct position, are designed to support the weight of the head, which is about 3 to 5 kilograms, he specified. However, he warned, for every centimeter that you drop your head forward, you double the load on those muscles. Looking down at the cell phone, with the chin to the chest, implies more weight on the neck. In addition to muscle pain, text neck syndrome can cause other health problems. Sitting in a hunched position restricts the ability of the lungs to expand. This situation can affect lung capacity. In addition, by inhaling less oxygen, the heart has to pump harder to distribute more oxygen-carrying blood throughout the body. Recently, Ira Fiebert, Ph.D., of the University of Miami Miller School with collaborators from the Massachusetts College of Health Sciences and Pharmacy, published a paper detailing the consequences of text neck and issued a wake-up call for healthcare personnel, parents and caregivers of girls and boys. It is likely that children who grow up with cell phones may experience adverse postural and musculoskeletal changes at an early age, which could cause problems throughout their lives, they said in a paper recently published in the journal Work. In addition, they noted the burden of backpacks carried by children, adolescents and young adults has been associated with increased complaints of musculoskeletal problems. The combination of frequent cell phone use and heavy backpack loads has the potential to cause significant postural problems, especially in the pediatric population. To improve the picture if the syndrome has already developed, these 3 tips from the Cleveland Clinic are recommended. 1. In text neck, posture must be improved. It is advised to learn to adopt a correct posture and align the neck. The person can observe him/herself in a mirror to become more aware of his/her posture. If properly erect, you should be able to draw a vertical line from ear to shoulder, Bolash advised. 2. Arch your back. If your posture is not perfect, you should try shoulder extensions. It is suggested to arch the neck and upper back backwards, aligning the shoulders under the ears. This simple stretch can relieve muscle tension and pain. 3. Look straight ahead. Instead of tilting your chin down to read your cell phone, raise the device to eye level. The same action should be taken with a laptop or notebook. The monitor screen should be at eye level so that the head is not constantly drooping and muscle tension is not generated. According to Dr. Bolash, if a person has neck pain, he should first try to relieve it with the application of ice or a heat compress and can do stretching exercises and taking. The pharmacy can be consulted if the consumption of over-the-counter medications such as acetaminophen to soothe the pain is advisable. It is also recommended to reduce the use of the telephone. You can take breaks or use it only for short periods.